Here is a comprehensive breakdown of the anatomy and physiology of coronary circulation. The coronary circulation consists of the blood vessels that supply the heart muscle, that is the myocardium, with oxygen and nutrients, and those that remove deoxygenated blood. It is primarily divided into the arterial supply and venous drainage. Arterial supply. The heart is supplied by two main coronary arteries that originate from the root of the aorta just above the aortic valve, that is at the sinuses of Valsalva. Left main coronary artery, LMCA, is typically short and bifurcates into two major branches. Left anterior descending, often referred to clinically as the widowmaker when blocked at its origin. It courses down the anterior interventricular sulcus. It supplies the anterior wall of the left ventricle and the anterior two-thirds of the interventricular septum, the apex and the bundle branches. Left circumflex courses along the atrioventricular groove towards the posterior aspect of the heart. It primarily supplies the lateral and posterior walls of the left ventricle and the left atrium. Right coronary artery originates from the right aortic sinus and travels down the right atrioventricular groove. It typically supplies the right atrium, the right ventricle, the sinoatrial node in about 60% of people, and the atrioventricular node in about 90% of people. Coronary dominance. This is determined by the artery that supplies the posterior descending artery, which runs in the posterior interventricular sulcus and supplies the inferior wall of the left ventricle and the posterior third of the interventricular septum. Right dominant, 70 to 80%, the PDA arises from the RCA. Left dominant, about 10%, the PDA arises from the left circumflex. Co-dominant, 10 to 20%, the posterior septum is supplied by branches from both right coronary artery and left circumflex. Venous drainage. Deoxygenated blood is returned to the right atrium through three main pathways. The coronary sinus, the primary collector of venous blood from the left side of the heart. It sits in the posterior atrioventricular groove and empties directly into the right atrium. Major tributaries include great cardiac vein, middle cardiac vein, and small cardiac vein. Anterior cardiac veins. These drain the anterior right ventricle and empty directly into the right atrium, bypassing the coronary sinus. They may occasionally drain into the small cardiac veins. Thebacean veins, venae caudas minime,